Sophie Quinn, student number N9440241. One of the problems that I have never put much thought into are extrication issues. Over the past couple of weeks of pracs, I've noticed this is always something that must be considered, and today I'm going to take a closer look into this. I recently got called to a job involving a 63-year-old male complaining of nausea. Male had a history of kidney and heart failure and type 2 diabetes. He was significantly overweight with ulcers on his leg and suspected cellulitis. On arrival, we entered the house and climbed a set of stairs that were narrow and had a tight turn to find the patient in a chair. After initial assessment of the patient, it was clear he needed to return to hospital. The first option that we attempted was to get the patient to stand, and it became clear that this was not an option as he was very unstable. Eventually, it was decided that another crew would be called for lift assist, and we used the stair chair. As I've said previously, I've not been exposed to the thought process that is involved in evaluating extrication and all the elements that need to be considered, such as equipment placement, effective communication. It is incredibly relevant to today's paramedic practice and is essential that I begin to understand the challenges early on in my studies. In my line of work as a medical receptionist, I come across minor instances with egress issues. However, as there are a number of elderly people who attend the surgery, I understand the mobility problems that can arise with comorbidities. Due to the nature of the medical centre, it has a very good access with ramps and a nice open plan for easy mobility. So I've not come across situations where I need to problem solve in extrication. I most definitely do not have the experience in this area at all, particularly in the finer details and complexities of extrication. What I found that was most similar to these experiences was in regard to communicating within the team. As we had to call another crew for lift assist, planning and communication was essential. My experience of this mainly involves discussing important messages with doctors and nurses as succinctly as possible to ensure the patient is getting everything they need. Although this is helpful, I do not have the added factors such as safety for patient, manual handling, and difficulty manoeuvring. Throughout my time on prac so far, it has become increasingly evident the relevance of extrication as obesity becomes more prevalent. This poses both risks to paramedics as well as to patients. Cowley and Leggett 2010 in the Journal of Emergency Primary Healthcare point out the further complications of bariatric patients that are associated with shape, mobility and cooperation, as well as a decreased lung capacity that inhibits their ability to help in movement. This needs to be taken into account when assessing what equipment can be utilised, whether the patient can walk a few steps or if the stair chair is more appropriate. Thinking of these extrication issues purely from a paramedic perspective, there needs to be good communication, coordination and cooperation between one another. Queensland Workplace Health and Safety Code of Practice 2011 corroborate this by stating, whenever team handling is used, it is crucial to match workers, coordinate and carefully plan the lift. In order for this to occur efficiently, I feel there will need to be a person in charge to allocate roles effectively and to extricate the patient while maintaining clear and succinct instructions. As much as all these factors are important, it is crucial to understand how this experience can impact the patient, not only clinically but emotionally as well. As I mentioned previously, it can be very distressing for a patient who is already vulnerable to go through a complicated extrication. In the journal Work, Higgett and Griffiths 2007 discuss how bariatric patients may have a fear of prejudice and embarrassment towards asking for help, which may delay their hospitalisation. I can understand how this fear would be very overwhelming, especially if there were multiple paramedics standing around discussing extrication, and it clearly shows how vital it is to maintain patients' respect, dignity and privacy. My brief time on road has given me invaluable insight into the daily challenges that paramedics face. This issue is definitely relevant to my future practice, as according to Murr, Heath, McLean, Bodner and Rock 2007 in the Nursing Consult Journal, there is a high mortality rate as there is often a delay in treatment for bariatric patients, and it is evident from this article that efficiency is key when assessing and transporting patients and understanding early what resources are needed to prevent this delay. I feel that one of the first factors that would need to be considered in a complex extrication is the environment. Factors such as room size, stair width and the floor surface all need to be assessed, as seen in Higgett and Griffiths in Work 2007. This will require myself from the beginning of arrival on scene to start actively observing these elements and looking for potential hazards. As well as this, I'll have to be aware of not only my communication with fellow colleagues but maintaining a good understanding of what the patient is going through. Queensland Health and Safety Handling of a Person 2011 point out how important it is to keep the patient informed of what is going on to promote cooperation. This would be particularly helpful when moving, for instance, in this case down the stairs, to keep their hands located on the chest to prevent them from reaching out. And if the patient comprehends this and there is a lot of reassurance, this will definitely achieve positive patient outcomes. Thank you.